This is the Mobile MOSFET Wireless Patient Dose Verification System from Best Medical Canada. It is an easy-to-use, seamlessly integrated system that minimizes dosimetry and QA time. The Mobile MOSFET is used to measure patient radiation dose, primarily in radiotherapy, such as in cancer treatment therapies. However, its flexibility also allows it to be used for other applications requiring the measurement of radiation dose. The MOSFET sensors, with an active sensor area that is just 0.2 by 0.2 millimeters, are located just underneath the black epoxy. The MOSFETs are temperature independent and isotropic. In addition to our standard MOSFET sensors, the Mobile MOSFET supports a wide variety of sensors for different applications. For example, it can use high sensitivity sensors for measuring lower doses. An exclusive advantage of the Mobile MOSFET is that it also supports micro MOSFET sensors, which are the same dosimeter packaged even smaller. So small, in fact, that it fits inside of the 6 French catheter, which enables it to be used interstitially for applications such as breast, head, and neck treatments. The linear 5 array, with all 5 sensors on one flex, gives a dose profile. The array can be used effectively for direct measurement of intracavitary dose profiles during gynecological and prostate procedures. There is a radio-opaque marker on the end of the flex which will give a visual indication of the sensor's location in CT and X-ray images. The Mobile MOSFET is a true wireless system that communicates by a Bluetooth transceiver, which can be placed on the wall of the treatment room. This eliminates any wires running from the dosimeter at the bedside. This, plus the fact that the system is modular, allows additional transceivers to be set up in multiple rooms so that the same unit can be used in several rooms. The Mobile MOSFET is completely software-driven, which enables it to be controlled outside of the room, making it easy to collect both dose data and calibration data. There are 4 main tabs on the initial screen, one each for equipment setup, treatment information, dose measurement, and the dosimetry report. The Equipment Setup tab is used to initiate the connection between the hardware and software. Once established, information is provided on the hardware status, including the amount of charge remaining in the battery, how much dose has been accumulated on the dosimeters, and what the calibration factors are. With this screen, the user can load, edit, and save calibration factors. The treatment information screen is used to enter patient data such as first and last names and registry number. This data is then automatically included in the dosimetry report to be put in their chart. A key feature enables the user to enter in the target dose and MOSFET locations. These information labels can then be dragged onto a JPEG or bitmap image, indicating the locations of the MOSFET sensors on the patient. The dose measurement screen is used to initialize the dosimeters. Clicking on Read opens a pop-up screen that will confirm that irradiation has been completed. If the irradiation has already been completed, click Yes to measure the integrated dose. A dosimetry report will be automatically generated, incorporating all of the data from the patient treatment information and the dose measurement. The report will include the calibration factors, the correction factors, and the location of the dosimeters. It will also output the dose and calculate a standard deviation from the target dose. The reports can be saved and printed, and can include comments up to a maximum of 100 characters. The reports can also be exported to Word and Excel files. In addition to those 4 main screens, there is an equipment setup screen which is used to calibrate the MOSFET sensors to ensure consistent readings. One of the big advantages of the MOSFETs is that they are linear over their lifetime and do not have to be calibrated a number of times like other types of sensors. A software wizard is included to greatly simplify the calibration procedure. Calibration factors are automatically calculated, showing the average and standard deviations of repetitions. Physical setup for calibration is made easier with the optional calibration jig accessory. The versatility, portability, and expandability of the Mobile MOSFET patient dosimetry system make it a valuable addition for radiation dose measurement.